Welcome to this educational video about carpal tunnel syndrome. If you've ever experienced numbness, tingling, or pain in your hand and wrist, especially at night, you might be dealing with this common condition. In this video, we'll explore what carpal tunnel syndrome is, what causes it, how it's diagnosed, and what you can do about it. Let's start with the causes. Carpal tunnel syndrome arises when the median nerve, which runs from your forearm into your hand, becomes compressed within the carpal tunnel. This tunnel is a narrow passageway in your wrist formed by bones and a tough band of tissue called the transverse carpal ligament. Various factors can contribute to this compression, including repetitive hand motions, forceful gripping, certain underlying medical conditions like diabetes or rheumatoid arthritis, wrist injuries, and even pregnancy. To understand how carpal tunnel syndrome develops, we need to delve into the pathophysiology. The median nerve provides sensation to the thumb, index, middle, and part of the ring finger. When the carpal tunnel narrows or tissues within the tunnel swell, pressure increases on the median nerve. This pressure disrupts the nerve's ability to transmit signals properly, leading to the characteristic symptoms of numbness, tingling, pain, and weakness in the hand. Prolonged compression can even lead to nerve damage. Carpal tunnel syndrome is a widespread issue, affecting millions of people worldwide. Its prevalence varies based on factors like occupation and lifestyle. It's more common in women than in men, and it typically occurs between the ages of 40 and 60. Certain jobs involving repetitive hand movements, such as assembly line work, sewing, typing, or using vibrating tools, significantly increase the risk. The signs and symptoms of carpal tunnel syndrome can range from mild to severe. Early symptoms often include numbness or tingling in the fingers, particularly the thumb, index, and middle fingers. These sensations may be more pronounced at night and can be relieved by shaking the hand. As the condition progresses, pain may develop in the wrist and hand, sometimes radiating up the arm. Weakness in the hand can make it difficult to grip objects or perform fine motor tasks. In severe cases, there can be permanent loss of sensation and muscle atrophy in the thenar eminence, the fleshy area at the base of the thumb. Diagnosing carpal tunnel syndrome typically involves a physical examination and nerve conduction studies. During the physical exam, your doctor will assess your hand and wrist for sensation, strength, and tenderness. Specific tests, such as Tinel's sign, where tapping over the median nerve elicits tingling, and Phelan's maneuver, where holding the wrists flexed for a minute reproduces symptoms, can help identify nerve compression. Nerve conduction studies measure the speed at which electrical signals travel along the median nerve. Slowed conduction across the carpal tunnel indicates nerve damage. While there aren't strict classifications or types of carpal tunnel syndrome, it's often categorized by severity: mild, moderate, or severe. This categorization is based on the intensity of symptoms, the results of nerve conduction studies, and the extent of functional limitations. Treatment for carpal tunnel syndrome aims to relieve pressure on the median nerve and alleviate symptoms. Non-surgical options include wearing a wrist splint, especially at night, to keep the wrist in a neutral position. Over-the-counter pain relievers like ibuprofen or naproxen can help manage pain and inflammation. Corticosteroid injections into the carpal tunnel can provide temporary relief by reducing swelling around the nerve. Physical therapy may involve exercises to improve wrist and hand strength and flexibility. When non-surgical treatments are ineffective, carpal tunnel release surgery may be recommended. This procedure involves cutting the transverse carpal ligament to relieve pressure on the median nerve. Preventing carpal tunnel syndrome involves minimizing risk factors and adopting ergonomic practices. Maintain proper posture while working, especially at a computer. Take frequent breaks to stretch and rest your hands and wrists. Use ergonomic tools and equipment that support neutral wrist positions. Avoid repetitive motions and forceful gripping whenever possible. Address underlying medical conditions, such as diabetes or rheumatoid arthritis, that can contribute to nerve compression. The prognosis for carpal tunnel syndrome is generally good, especially with early diagnosis and treatment. Many people experience significant symptom relief with conservative measures like splinting and medication. Carpal tunnel release surgery is typically successful in relieving symptoms, although it may take several weeks or months for full recovery. Recent research focuses on improving diagnostic techniques, refining surgical procedures, and exploring alternative therapies like acupuncture and yoga for symptom management. Researchers are also investigating the genetic factors that may predispose individuals to carpal tunnel syndrome, potentially leading to more targeted prevention and treatment strategies in the future.